Hello, I'm Dr. Craig Escude. Welcome to Medical Monday. Clinical Pearl number 52 from the book Clinical Pearls in IDD Healthcare talks about positioning for better functioning. So, throughout my career, I've seen a lot of people who have limitations in body functioning. It might be their upper extremities, their arms, their legs, their torso, their head, their neck, because of cerebral palsy or other issues. And at first, it starts off as spasticity, meaning that it's really tight, but it can be moved, okay? But if something stays in a position long enough, it kind of gets frozen, and we call these contractures, and you can't move them anymore, okay? So it's really important to try to help support people to use extremities to their fullest to keep the function that they have, or possibly even regain it when it's possible. So how do we do this? And one of the things that we see is physical therapy. And physical therapy has a lot of tremendous benefits in a lot of different ways. But I want to look at it in terms of a dose of physical therapy, and how the right dose might be more helpful. Now, to do that, I'm going to ask you to think about dieting, and let's talk about that. So if we want to lose weight, we pretty much have to maybe rework all of our daily intake, right? We don't just simply say, let's just 3 times a week, I'm going to have, say, a meal that's well balanced, that's healthy, that has only, let's say, 300 calories, but the rest of the time I'm going to eat what I want. So if 3 times a week you have a meal that would help you lose weight, but the rest of the time you eat what you want, how successful do you think you'll be in achieving your goal? Probably not very much, right? So let's take that with physical therapy for someone who has spasticity. Let's say 3 times a week they go to the physical therapist, they get excellent treatment, and they have a range of motion exercises that help stretch their arm out. But all of the rest of the time, all of the other hours and minutes and days, their arm sits in this contracted position. Or how successful do you think that 30 minutes, 3 times a week of physical therapy might actually be? And the answer is probably not that much. So what we need to do as supporters is we need to think about what can we do to help people most of the day, most of the time, to improve their movement and their function of their affected parts. And there are things that can be done. There are different types of positions or working positions that a person can be supported in that can help them use, say, an arm that they normally might not want to use, or help strengthen other movements or muscle systems. And we can learn about these things from physical therapists and occupational therapists who have experience in this field. And it's things that we can all do that aren't that hard to do. It's just a matter of learning about them that can help really reduce contractures and improve overall functioning of a person. So, seek out a good physical therapist, occupational therapist, and follow their recommendations to help the people that you support keep as much function as possible and regain as much function as possible.
Hey everybody, thanks for watching this episode of Medical Mondays with Dr. Craig Escude. We got a ton more in the backlog, so if you want to check those out, we got a playlist on YouTube, or you can listen to it on our podcasting platforms. We just want to make a quick note that Friends for Life is currently hiring, so if you'd like to come work with us here at Friends for Life, head over to friendsforliferc.com, go to our employment page, fill out the form, and we'll get back with you soon. And we also have a new show airing now called Nursing in No Time, kind of as a compliment to these Medical Mondays. So if you'd like to check that out, also available on our YouTube channel. And as always, you guys can check out the Friends for Life podcast and our midweek minis. So thank you for watching. We'll see you next week.